We're here with Dr. Gatt, and he's going to be speaking at our third annual summit. So we're just going to ask you a few questions about the topic here you're coming in to speak on. So first off, have you witnessed an increase or a decrease in the frequency of overuse injuries among adolescents in your practice, and how significant is this problem? What do you attribute it to?
There's no question that there's a definite increase in the number of overuse injuries I see in very young athletes, middle school, high school athletes. I think I attribute it to the fact that the intensity with which kids play sports these days has gone up markedly. The days of schoolyard basketball and playground kickball and things are over. Now everything's organized. Everyone's super specialized at a very young age. I see more and more children choosing one sport very early on, so playing soccer year-round or playing baseball year-round and not really having a lot of opportunity to try other sports. And I think that all of those things combined probably lead to this increase in overuse injuries, that the expectations that the children are putting on themselves, the expectations that the parents are putting on their children are all much higher than I've ever seen before.
So what suggestions can you offer parents who have these very active kids and are concerned about their overuse injuries?
Well, I think number one is to realize that there really is an almost epidemic of overuse injuries in kids, and it's not unlikely that your kid will be one of the kids who suffers one of these overuse injuries, and they really do have some detrimental side effects. It can lead to long-term problems with joints. It can lead to loss of interest in sports. I see early burnout in kids where the kids don't even make it through their high school career playing sports because they're tired of the injuries. So I think recognizing the fact that these things have long-term problems is something to recognize for the parents, and then telling them, first and foremost, sports should be fun for the kids at any age. It's not, as opposed to looking at sports to the ticket to the next level, it should be something that kids enjoy doing so they learn a lifetime of enjoyment of sports rather than it being so goal-oriented.
The American Academy of Orthopaedic Surgeons has a big campaign to highlight the significance of the overuse injuries. What is the campaign all about, and why is this an important issue to discuss?
The real gist of the campaign revolves around education, trying to educate parents, coaches, any caregivers for that matter, about how big a problem this is nationwide. And the idea is to get back to the points that I just pointed out that I'd like to discuss with parents, that these overuse injuries can lead to long-term joint problems and disability later in life, but more importantly that our kids should be having fun playing sports and avoiding these injuries. So I think the real drive for the program really is to educate everyone involved in youth sports, from all the way from the kids to the coaches at all levels.
So what is the greatest role that an athletic trainer can play with the adolescent athlete?
Well, my experience with athletic trainers is that they've been aware of this problem probably longer than the general public, longer than a lot of physicians that I know for that matter. And I think they have the kids' ear. As a physician, I see the athlete come to my office once a month or less frequently than that, whereas the trainers see the kids every day. They understand their mannerisms. They understand when an overuse injury may be starting up, and I think they probably recognize it the earliest. And once they recognize the start of it, I think it's incumbent on them to take the kid aside and say, look, this is what's going on. Maybe you should talk to your parents about it. Maybe I should talk to your parents. So I think the trainers are the first person who's going to recognize an injury and get treatment started, or actually activity modification started, which is probably the most important aspect of the care.
And lastly, looking at the speakers and the variety of topics that we have at our conference, what's your impression of this year's summit that we've put together?
No, I think it's fantastic. Bringing people into central New Jersey who are experts in various fields involved in sports medicine, and so the conference itself offers something for everybody who's involved in the care of young athletes.
Great. Thank you for your time.
Sure. Thanks.
Appreciate it. Thank you so much.